In part one, we talked about different theories that exist about coping and what relevance coping has in terms of nursing. And we brought up the importance of identifying interventions to optimize their level of functioning and therefore their quality of life, and looking at things like the Institute of for Healthcare Improvement's triple aim of healthcare reform to improve patient experience of quality and satisfaction, to improve population health, and to reduce the per capita health cost, so that triple aim basically works to take care of person, population, and reserving those healthcare dollars. We're going to resume our discussion now by looking at factors that influence psychosocial function in older adults. And that's really influenced by personality, experiences, physical and emotional health, and by socioeconomic environmental conditions. All those have a real strong play into it, but we need to kind of keep track of where the need is and what's available. And then religion and spirituality really play into it. Religion, looking at that as being an organized system of beliefs and behaviors shared by a group of people, versus spirituality, where somebody has belief that there is a higher power that's providing what's going on in their life without necessarily having a strong religious affiliation. And lastly, cultural considerations. There's something called culture-bound syndromes, which are specific manifestations that are unique to a cultural group. And there can be different types of healing systems, and those do need to be recognized. It's both important for the culture itself and for the patient who has a true belief that that makes a difference on whether they're going to be well or whether they're possibly going to die. When you look at the factors that influence psychosocial function, we're really looking at factors that contribute to high levels of stress. We've seen all these already in our discussions that we've had, with the impacts that poor physical health, weak social support, lack of economic resources, and all such things there can have that affect psychosocial function. So looking at the functional consequences that are associated with it, certainly anxiety plays a huge part into it, both ordinary anxiety, feelings of distress, and late life anxiety disorder, when things are changing because the person sees themselves aging, they see others around them passing on, and they have an uncontrollable worry that's actually interfering with their daily life, and that can lead to serious physical and mental discomfort. And then loneliness, where it's seeing more and more impacts of social isolation and what it has in terms of a person's well-being, leading to things like Alzheimer's dementia, leading to poor nutritional habits. Loneliness is just not a good thing. And then resilience, difference between growing old and not just getting old, but rather how to grow old well so that you're optimizing your level of function all through those older years. And it really becomes linked with some of the other things we talked about, with spirituality, with hopefulness, and hopefully finding meaning in both life and in the losses that occur naturally as a part of life. This can help the nurse bring out specific nursing diagnoses. Those can vary depending on whether they are at risk, whether they have them, or if they're ready for some improvement there, but need some help kind of getting the Kickstarter going and seeking out more enhanced spiritual well-being or better coping and resilience skills. And that's a nursing function to help bring those out. When you're planning for wellness, you're looking on ways to reduce the stress and hope enhance the coping skills and overall improve the quality of life. The outcomes that you're seeking need to be realistic for that person, realistic and measurable, a term you're going to hear a lot of times, whether you're creating a formal care plan or just mentally working on creating what that patient needs to achieve their goals. Interventions can be lots of different things, but you need to incorporate strong therapeutic communication type techniques there and still allow the person to have a sense of control of what's going on. No one at any age really wants to be told what to do, but they sure want the guidance on how to help themselves achieve what they want to do. And that's what promoting sense of control means. Look at all the different needs that they have, certainly options that are available to help create a better quality of life. Don't make decisions for your patients, though, but help themselves in making decisions, and then incorporate those into your plan of care as well. Lots of different ways to build good self-esteem and good rapport and better their lives. But there's a tendency of people with ageist responses to use infantilization, treating adults as infants, or using elder speak, adjustments to speech patterns such as speaking more slowly or more loudly, using low-grade vocabulary that goes under an assumption that older adults are all cognitively impaired or older adults are all incapable of understanding normal speech. You might have to adjust depending on a situation there, but not everybody needs to be treated with one common blanket thing. And please, please, please avoid words like, come on, sweetie, it's time to go to bed. Come on, honey. Those types of things are not healthy. They don't develop a good relationship, and they're just downright degrading. Promote a sense of control, again, is really key no matter what level of thing you're trying to achieve with the patient. If it's simply getting ready for bed for the night, for somebody that needs some help with that, giving them options to choose from, simple options that they can make a choice between A or B, but don't do the talk around that sometimes happens, especially if family members are present. You want to involve older adults in the decision-making process. So talk to them instead to the older adult as part of the conversation. And it's real easy to find yourself falling into that trap of talking to a caregiver and saying, he says. You can circle that back around very quickly. So and so, this is what you're telling me. I want to make sure I understand what I'm explaining to your wife or your husband or your son, and have them get it out. And using verbal and non-verbal communication techniques that are active versus passive to show support and show caring, and yet still keep them on track for what it is you need to have done. It's okay to address the loss that's occurring in their lives. In fact, probably is good to have them talk it out, but then redirect what that means to seeking out a healthier lifestyle for themselves. Finding the social support systems that are necessary to get them involved so they don't feel like they're going to die alone, for example. Addressing those spiritual needs, getting them involved in religious activities if that's their thing, or certainly allowing them to talk about their spiritual needs, even if it's not a specific religion. So many nurses are afraid to talk. In fact, there's studies out that 70% of nurses are afraid to bring up any kind of spiritual or religious type discussion, and patients are many times thirsting for that information. You'll find out real fast if they have an interest in talking about it or not, simply by bringing up as part of a normal assessment process. Then look at managing ways to manage stress in daily life better, and perhaps getting them involved in healthy aging classes so that they can find ways to live life to its fullest in a more complete and better manner. This will result, if you're successful in your goals there, when you evaluate positive self-perceptions, having more involvement in decisions that are being made about their own care. They'll feel like they're more in control of things because they are, and they'll develop more effective coping strategies for those changes in life that sometimes can be adding stress to their lives. It's a challenging thing, there's no question. It requires a tremendous expense of energy by everybody that's involved in the care of that patient. That's why nursing is so involved in the coordination of that care. And then nurses need to talk with one another too. Sometimes talking out the feelings and emotions that they're having, because that's important as well. You're going to provide a healthier level of care for your patient if you have a healthier look at what's happening as well and can talk about it with others. Thanks a lot for listening, and we'll see you next class.